Mama.
What are ACE inhibitors?
Oh, ACE inhibitors. Those are also anti-hypertensive medications, which means they lower blood pressure. And so what they do, well, you guys got to know first what the renin-angiotensin-aldosterone system are or is. Your kidneys release renin, which is a hormone, in response to low blood pressure, and it converts an enzyme called angiotensin 1 into angiotensin 2. Angiotensin 2 constricts blood vessels, and which increases blood pressure. And then your body, your adrenal glands, the cortex releases aldosterone, which reabsorbs sodium. Hence, your body maintains hydration. It keeps more fluid, and your blood pressure also goes up. So that's called the RAS system, the renin angiotensin aldosterone system. When it comes to ACE inhibitors, angiotensin converting enzyme inhibitors, they block the converting enzyme that converts angiotensin 1 into angiotensin 2. Therefore, they dilate the blood vessels and they lower the blood pressure. So that's what ACE inhibitors do. Remember that ACE inhibitors end in pril, like lisinopril, and you got to remember that people that are taking ACE inhibitors, they can have a dry hacking cough. It's really, really bothersome for the patient, and they will also potentially develop hyperkalemia, because what ends up happening is these medications do not, the ACE inhibitors, they prevent aldosterone from being released. Therefore, your body dumps sodium, and wherever the sodium goes, the potassium becomes the opposite. And those are your ACE inhibitors. You'll also develop things like angioedema, which is very prevalent with these patients. And just make sure you monitor their electrolytes. And for orthostatic hypotension as well, as the patient gets out of bed and moves around in bed, the blood pressure may drop real quick. So that's what you got to be careful with ACE inhibitors.